A conversation about loss and a message of hope during Suicide Prevention Month. The number of people taking their own lives increased last year. The Minneapolis Health Department is working to reach out to those struggling. Our Callan Gray spoke to a woman who's lost 4 people to suicide, including her uncle, and she talks to them about the help available.
It is a very different kind of loss.
Cara Herdman has vivid memories of receiving the call her uncle, Paul Lee, had died by suicide on Christmas Eve in 2006. She remembers before his death, her uncle struggled with anxiety, depression, and substance use disorder. She feels his loss every day.
It's kind of just an open wound that doesn't ever seem to fully close and heal. It's very devastating because you always have this thought in the back of your head if there was something else that I could have done.
Herdman, who works for the Minneapolis Health Department, is sharing her story as a way to reach out to others and share the help available as part of a campaign this Suicide Prevention Month.
We need to make sure this is a very important conversation that can be had without stigma attached.
Suicides are increasing in the United States and in Minnesota.
Statewide, at least 835 people died by suicide last year. That's the highest number of people since 2019, according to the Minnesota Department of Health.
We don't know all the reasons, honestly. Depression and anxiety certainly play a role. Having access to means, and I think loneliness.
NAMI Minnesota Executive Director Sue Abderholden says there are warning signs to look out for, including if someone says they're a burden to others, they're extremely sad or feel hopeless, they express they want to die, if they start giving things away, have increased substance use, are sleeping too little or too much, or are withdrawing from others. The best thing to do, Abderholden says, is to talk to them.
Even ask them, are you thinking about killing yourself? Does not plant the idea, but it does also tell that person that you're noticing changes in their behavior, you're worried about them, and that you care about them.
And Herdman encourages those who are struggling to know there is hope and to ask for help.
We would much rather you ask for help and be here. Sorry. I wish I could have said that to my uncle, that, you know, I want him to still be here. It's more important to make sure that you stay here and you're here with your family and friends, and that know that you're loved and cared for, and that there are people and resources that really want to help. They really, really do.
They both tell us one of the most important resources is the number 988. You can text or call that number if you're struggling. There's a trained crisis counselor available 24/7. There are also mobile mental health crisis teams across Minnesota that can travel to your location. We have information about how to contact those under the Featured on 5 tab of our website. Live in the newsroom, Callan Gray, 5 Eyewitness News.